Hey everyone, welcome back to Life in the Crapper with Zach. Today we're going to go over part 2 of my personal story with IBD, picking up from where we were last time. Now I was seeing my local GI specialist and he said, well, it sounds like you have IBD, we'll have to do a colonoscopy to confirm. And again, there were no signs of the pericryptal inflammation or the granulomas, but that's okay because they said there was enough visual evidence to diagnose IBD. So the trouble with my colonoscopy was they could see inflammation up to about 30 centimeters within my colon. And then they noticed a little bit of an ulcer near the terminal ileum, kind of about where the small intestine connects to the large intestine, kind of near the appendix. And so, the thing is, they don't know if that's just an ulcer from something else or if it's related to the disease. So they could definitely diagnose with inflammatory bowel disease, but they couldn't say whether it was Crohn's or colitis. And so he started me on prednisone, which is a corticosteroid. It's really good at getting symptoms under control, but it has a lot of nasty side effects that you will experience. It's not like those commercials that list them fast and go, you may experience this. This one, you definitely will. Like if you stay on prednisone too long, you'll get osteoporosis. And so at the time, before I was on this medication, I was in bad shape. I was doing probably anywhere around 20 bathroom trips in the day and 4 or 5 during the night. So I wasn't getting any sleep, I was just worn out. And so after 2 days of being on this, I was cut down to like maybe 10 trips a day, maybe 1 trip a night, and I was starting to get sleep and it was just getting better. And then he also prescribed me Lialda, which is anti-inflammatory. Lialda wasn't working too well, and then we switched to Asacol, all kind of in the same class of drugs. And so I was on prednisone and Asacol for a while, and those were helping, but they weren't quite getting things under control, like not to where I could live a normal life. So the next step was putting me on something called azathioprine, which is an immunosuppressor. The problem is it can take 2 to 3 months to kick in. So they were weaning me off of the prednisone because it's so dangerous. They had me on the max dosage of Asacol, and then they slowly worked me up to the max dose of azathioprine. So from August to about January was this period of trial and error of putting me on prednisone, putting me on Lialda, then Asacol, upping my dosage of Asacol, lowering the dosage of prednisone, upping the dosage of azathioprine until things were sort of under control. And so by the end of January, I was down to maybe 3 or 4 bathroom trips a day and minimal blood, and things were looking pretty good. And then I was also at the time trying to follow this diet called the specific carbohydrate diet. IBD patients in general have lost the ability to process carbs, and carbs tend to produce more of the sugars and stuff that feed the bad bacteria, and so it kind of perpetuates this cycle of bad bacteria living in there and just creating havoc in your intestines. So for a lot of people, when they followed the SCD to the letter, they experienced remission. Now for me, that wasn't the case, but it did help. I would have less pain, but still it wasn't like this cure-all, unfortunately. So between the prednisone, Asacol, azathioprine, and SCD, got things to where they were okay before the wedding. And then they had the wedding, and then things started to slowly get worse. Like the blood was starting to come back. Went to the GI specialist, and he said, well, we'll try some of these other anti-inflammatories. I went through Asacol HD, sulfasalazine, balsalzadide, and nothing was helping. So again, from about February to May was again this process of experimenting with different drugs to try and control the bleeding and everything. And so in May he said, well, maybe it's time for another colonoscopy. I said, what am I going to learn from another colonoscopy? He said, well, maybe the inflammation's worse, maybe we can make a diagnosis of Crohn's, and it's the only way I can prescribe you the next step of medication, which is biologic therapy, which is things like Humira or Remicade. And what those are they're called TNF blockers. The Crohn's body is creating too much TNF. That's the inflammation that's going on. And when you inject Humira or Remicade, they start to bind to those receptors. You know, they take up that place so that the inflammation is therefore inhibited. And so he said, I can't prescribe you the Humira right now until we do another colonoscopy. So in May, I went in for my second colonoscopy within 6 months, and they found a little bit of inflammation higher up around 40 centimeters. And he said, well, now I think we can diagnose it as Crohn's and I can prescribe you the Humira. Well, this was also the time that Becca and I were finishing Ghosts and had to pick up and go to Michigan. So then it was a whole process of fighting with the insurance company to approve the Humira, because it was a tier 4 drug and they were only going to cover maybe part of the cost of a 30-day supply. And so the thing with insurance, you really have to be your own advocate, ask a lot of questions. If you have forceful parents, have them harass insurance a little bit. And what eventually, because this is how much it costs. It can cost $1,000 a month for maintenance therapy. My initial injections of 4 shots for 1 week and then 2 shots, that package cost $6,000. Now thankfully I only had to pay $140 because AbbVie, the parent company that owns Humira, has a patient's assistance program and they can cover up to so much. And so it was a fight to get it, but eventually we did get the Humira. And so we're up in Michigan, and I do 4 booster shots of Humira. That's how you start. And then 2 weeks later you do 2 booster shots, and then 2 weeks after that you go into the maintenance period, doing 1 shot every 2 weeks. Now the first 4 shots worked great. I had, some people say it takes weeks. For me it worked like overnight. Like the next day I had like a normal poo, no blood, it was formed. I was like, this is amazing. I've never been so excited over my poop. It's crazy. But the sad thing was it only lasted for about a week and 2 days. And then I was like, and then the blood came back and things started to get worse. And I said, well, it's okay, I'm close to the 2 booster shots. Well, I did the 2 booster shots and it didn't really help. It just kind of kept things where they were. And so I was kind of at this point where I was doing the Humira. I was kind of keeping things at this okay level, but there was still blood, there was still plenty of trips to the bathroom a day, and trying to do the show and teaching at the same time, and it was, you know, exhausting. I even called up my GI and I said I need some help to get through the summer, and so he put me back on prednisone for a while. And this was after I had almost had a small emergency room scare in Michigan, because there was a night where I had a lot of pain, and it was just bad. And so I didn't go to the emergency room. I stopped eating for a couple days. And then, so I made it through the summer, made it through the production, kind of on this combination of Humira and prednisone. And then as soon as I got back to Reno, was when I had to go to the emergency room, because I just had this day where the pain was getting worse and worse, and then I couldn't eat anything, and then I couldn't drink anything, and I was dehydrated, and the pain was some of the worst I've experienced in my life. And I finally caved and said, let's go to the emergency room. And so they rehydrated me, they gave me some morphine for the pain, and they did another CT scan and said, well, there's no new inflammation, yeah, and so we'll let you go. And so that was frustrating. It was even more frustrating because I had called my doctor that day and said, I'm in a lot of pain, I'm going to go to the emergency room if you don't get back to me. And they didn't get back to me. And then the next day, next week when I had my follow-up appointment, even though the emergency room had called and left messages for the doctors, the doctor had not been informed. So that was frustrating. That pissed all of us off. And that was when my mom and dad were like, okay, you need to seek out some experts and get some second opinions. And so that's what I've done. And so that'll kind of bring us to the close of that section. Next time we'll focus on some of the alternative therapies I've explored in the past few months out of my frustration with conventional therapies, and also the experts who I sought out. So I'll see you guys next time. Thanks, and good health to you guys.